Hi, I'm Natalie Aguilar, a certified personal trainer and a pre and postnatal exercise specialist. Today we're going to be talking about core activation, why it's important, and how to engage and incorporate your core into your regular daily movements. So first, let's look at why proper core activation is important. Some of the benefits of being able to have a well-functioning core are fewer pains or injury, better, easier movement, easier labor, faster recovery from birth, reduced stress, improved immunity, better digestion, and healthier fetal growth development. So first, I just want to point out that only 3 out of those 8 benefits were pregnancy and postpartum specific. So this is an important aspect of anyone's training routine, and I would highly recommend everyone incorporates these practices. So we're going to be going over how to activate the core canister muscles and what those are. The core canister muscles are all the muscles involved in breathing and supporting your organs. Each of these muscles in the core canister have their own role in this, and when they really work together is when the magic happens. So we're going to start from the top with your diaphragm. When you inhale, your diaphragm is going to expand and go down. As it goes down and you breathe in, your transverse abdominis are going to lengthen, relax, and open up in order to make room for that breath. In the same way, your pelvic floor is going to do the exact same, where it's going to release, expand, and go out and allow room for that breath. A lot of our times, we decondition ourselves to not breathe properly. We hold our core in, trying to suck in, allowing that breath to go up into our chest or even down into our pelvic floor, creating pelvic floor dysfunction. We want to make sure to be able to allow our core to fully expand here at the center. We're going to be learning a technique called 360 breathing that is going to help you optimize your breathing technique. In order to perform 360 breathing, I want you to find yourself on a seated surface. I'm going to have you sit down in a chair, maintaining that upright, neutral alignment posture. And you're going to take your thumb and your forefingers and wrap them around your ribs. We are going to be thinking about breathing all around, expanding in every direction into that thumb, the cup of your hands, as well as your fingers. Primarily focusing on the thumb and the side of the hand, because that is the most difficult technique to master. We don't often think about breathing into our back in that way, but we want to focus on that full 360 expansion. So you're going to sit in neutral with your shoulders relaxed. Then you're going to inhale through your nose and expand your rib cage 360 degrees, emphasizing expansion in the side and the back of the ribs. Next, you're going to exhale fully through pursed lips. I want you to think like you're blowing up a balloon with this until no air is left in your lungs and the navel draws into the spine as a result of the exhale. That is your 360 breathing. It will benefit you to practice that at least once a day in order to properly make that mind-muscle connection of the proper breathing. And once you get it down, you're performing about 2,000 reps a day of the best core exercise out there. After you have mastered the techniques of 360 breathing, apply it into your exercise movements. You do this by inhaling on the easier portion of the movement, then exhaling during the exertion or the more challenging part of the movement. So I'll show you how it's done here in the squat, where I'm inhaling on the way down and then I exhale and explode up in order to create the best force from that exhale. Now, it is common for people to hold their breaths during the movement in order to provide more force. Yes, you are getting more force from holding your breath, but you are also creating more intra-abdominal pressure, which can lead to a dysfunctional core and pelvic floor. So we want to avoid that and make sure that we are coordinating the breath with the movement. The next technique we are going to focus on is pelvic floor activations. This one is a little bit more difficult to show and a little bit more difficult to train because we can't necessarily see these muscles and the movements happening, and it takes a lot of mind-muscle connection. These are pelvic floor activations, very different from Kegels. What we're going to be focusing on here is the full tightening and full lengthening of the pelvic floor. The pelvic floor has about 14 different muscles with 4 different attachment points, all acting as a hammock between our legs to support our organs. The 4 different attachment points are going to be at the front of the pelvic floor, which is our pee stopping muscles, and at the back of the pelvic floor, which is our poop stopping muscles, and then to the sides where it attaches to our hip bones. During pelvic floor activations, we're going to be focusing on all 4 points of contact and being able to have a mind-muscle connection with each of those. So first, we are going to focus on them individually. I'm going to have you sit on a corner of a chair because that sometimes provides very beneficial feedback in order to activate those muscles. And when you're performing this today, you might not be able to find or locate mentally these muscles this first time, and that is okay. Practicing is going to take some time depending on which attachment points you are most familiar with, but I promise you that as you practice these daily, you will be able to find those attachment points and you will notice a difference. Having a proper functioning pelvic floor is going to support your organs and prevent prolapse. It is also going to support and prevent incontinence. So now I'm going to have you sit down on a chair, and I'm going to have you locate your pee stopping muscles and think about drawing those up and in. Once you have done that a few times, I want you to then go to the back and think about your poo stopping muscles and draw those up and in and locate those. And then you're going to take your hands and place them under your bum in order to locate your 2 sit bones right in the middle there. And think about drawing those 2 points of contact up and into each other. Your glutes should stay relaxed on this movement, and the movement should be much deeper into the pelvic floor. The next step after you have located all 4 contact points is to coordinate them all together. So now you're going to think about lifting all of them up and in together, and then relaxing and lengthening them back out. Focusing on the lengthening of that portion is going to be super important for a well-functioning pelvic floor. A lot of times, like with Kegels, we're focusing on the tightening and not thinking about the lengthening. There are 2 reasons why focusing and incorporating the lengthening is super important for a well-functioning pelvic floor. First, when we are pregnant, we need to allow the baby to come out. We need to allow the relaxation of that pelvic floor to lengthen and guide the baby out during childbirth. 2, if we do not have full access to a range of motion of a certain muscle, that muscle is not going to be able to perform at maximal strength. You think about if you're in a bicep curl and you're constantly held in this position, you are not going to be able to produce as much force as if you were able to lengthen all the way and then produce the force from there. Think about like a squat jump. You get more force as you're able to squat down lower and then explode up. But if you're only able to squat down halfway, you might not be able to give as much force. So practicing the lengthening of the pelvic floor is super important to be able to have full strength of that pelvic floor, which will help again with the quick movement of incontinence. So we have found those 4 different points. We have coordinated the movement of all of them together, focusing on tightening in and then lengthening. The next step you will be doing after you have mastered those first 2 steps is to coordinate it with your 360 breathing. Like I said, we want to lengthen. Our pelvic floor will naturally lengthen as we inhale. So we want to emphasize what is already happening naturally. So when you inhale and you're focusing on your 360 breathing is when you're going to focusing on the lengthening of your pelvic floor. And then when you exhale and you draw your navel in with blowing out your birthday candles, you are also going to be drawing in and up that pelvic floor, practicing that coordination. That was a lot, and that is only the very first techniques leading to optimizing our core functioning properly. There are many other techniques we can use after this in order to progress this to the next level. So I wanted to start here. If you've mastered those and you're ready for more, feel free to keep an eye out for my next videos that will come out in order to progress these movements to the next level. Thank you so much for watching, and I'll see you next time.